Good afternoon. We thank God Almighty because we are here because of Him. He is the one that made it possible through the lottery in Nigeria, US, and India for us to come here for have our baby TOF operation. We have to thank the doctors, the management, and all the lottery club here and outside. Those we know their name and those we did not know. And all the nurses, we love them all. May God bless all of them. In Jesus' name, amen.
Hello everybody. This is just to share a positive story. The story of a child from Africa who came all the way to get a treatment from us. Her name is Miracle, and Miracle is a child who was born with an inborn error of the heart. She had tetralogy of Fallot, which is one of the commonest causes of so-called blue babies. And in addition to tetralogy, her artery of the left side of the lung was very small. She was initially diagnosed in her native country, and with the help of visiting teams from abroad, they wanted initially to perform the operation there, but because of limitations in Nigeria, they wanted to seek help outside. And that is when Narayana Superspeciality Hospital came into picture, and with Rotary International's help, she was flown all the way from Nigeria and came to us. It is a matter of routine surgery for us, but still it was a challenge. She recovered well, and in addition to the anatomical challenges, she also had a sickle cell anemia trait. This is a genetically transmitted anemia which is prevalent in that part of the Africa, and these children are more prone to developing visual disturbances, stroke and other complications. And not only the surgical team, the cardiology team, anesthesia, perfusion, and everybody involved in the care of Miracle took special care to avoid any complications. And we were lucky that on day 6 she was able to be discharged, and we hope that in a day or two she will be able to fly back to Nigeria and lead a near normal life like a normal happy child. Thank you.
My name is Aniagu Joseph Chukwumeke. We are from Nigeria. My daughter was sick when she was 1 year old. So we went to hospital there. She was diagnosed of TOF. That is, they said is tetralogy of Fallot. So we wanted to do it in Nigeria, but because of lack of equipment there, so we could not do it in Nigeria. And the cost equal to do it abroad was high, so we started looking out for help. It was lottery E-Club of E-Club 1 USA that started helping us. So they're supposed to help us to do it in Nigeria, but because of the lack of equipment, he started looking for another place to do the surgery. That's why we searched for India. So India, being good in medicine, that is why it's an option. We wanted to do it in Italy because there were a group of surgeons from Italy that came to do it in Nigeria at that time. They were equally good, but their cost is too expensive. So India is very good, and it's even cheaper to do it in India than to do it in, and you get the same quality. So the surgeons started reaching, the lottery started reaching out for friends. So that was why they came to meet this lottery club of Calcutta. So it was Dr. Ramesh Tiwari, from what I learned, that directed us here. So, and I heard, from what I heard before coming here, that this hospital is so nice that they are very experts in treating such a case. So when we came here,
Baby Miracle is one of such babies who came to us from long faraway land, Nigeria, and she came here in the month of November 2018 with a heart ailment called tetralogy of Fallot. This heart ailment has a hole in the heart, and obviously the lung artery is very much stenosed or narrowed, so that the blood which she is carrying all over her body is actually a mixture of red and blue blood, and she was quite blue. she was unable to breathe properly and walk and talk properly, and she was basically hampered in life. Baby Miracle needed a CT angiogram by which we could discover that her branch pulmonary arteries where the surgery would be done are quite narrow, and anyway she had a high risk and for surgery, and along with Dr. Debasis Das, our cardiac surgeon, along with the consent of the parents, we went ahead, and with God's grace the child fared very well and she was discharged back home on the 6th day, post-operative day. She is doing well now, feeding well, and likely she will gain some weight in the forthcoming months. Obviously she needs to be under medical supervision and have regular follow-ups and follow up with echocardiogram, chest X-ray and ECG, which can be done at their country. And thank you all for all the information which you all give us and all the feedback which you all give us. We look forward to them, and we will urge you to come forward more and more so that these children who are thought to be all hopeless cases, they can go back to normal life after a fruitful surgery or intervention. Thank you all very much.
We noticed from the look of things, the hospital is so big, well organized. The management is equally good. Like when you come in from cleaning the environment, the treatment from the nurses, from the cleaners, as in, we made friends. Every person working here, I think, is well trained in the field. So I think the management, from what I've seen, the management is very good. And the people they employed, they treated us so well that we came for treatment, but we made a lot of friends here. I have to thank the management of the hospital, especially Dr. Debasis that treated my daughter, and this lady Bashwati, Dr. Bashwati. Anytime I call her, this is what I want, this immediately she will just show up. I won't take her much, even she, from what I see, because she used to be busy, but she has to create time and meet you. Whatever you want, she will just immediately provide it and go. So she doesn't have enough time, but she must attend to your needs. I think all the doctors, even the doctor that did ECG, 2D echo, they're very nice. As in the way they will calm your child, you know that you are dealing with someone, so they have shown us so love. Thank you.